Alright, I have single leg squat with knee valgus, and why is designing an exercise program for this crucial? And it's because it addresses the biomechanical issues that have significant consequences for movement, as well as joint health and injury prevention, because a lot of people who have knee valgus, they tend to tear their ACLs a lot more, so having this program is going to prevent one of the worst injuries. Alright, we're doing inhibitory technique for our first one, and it's basically like our trigger point therapy using self-myofascial release by using a foam roller. This is stimulating your GTO with autogenic inhibition. Alright, this is going to inhibit the muscles, so it's going to be 3 to 5 days a week depending on the individual needs and tolerance. It's going to be comfortable but not super painful. And we're going to hold the tender spot for 30 to 90 seconds and total of 2 to 3 minutes. Contradictions would be open wounds, acute injuries or inflammation, any recent injuries near the site. Precautions is avoid applying pressure directly to the greater trochanter and gradually increase pressure. Do not start with maximum intensity. And to use a foam roller with a softer density for beginners. Alright, our next technique is lengthening technique, and this is going to lengthen a mechanically shortened muscle by using static stretching. Perform this daily, doing 20 to 30 second holds, but if you're older, around 60 to 90 holds, 2 to sets per leg, 1 to 2 repetitions, allowing 10 to 15 seconds of rest in between. It should be mild discomfort but not pain. Contraindications are severe knee injuries, severe hip joint dysfunction. Precautions is avoiding forcing the hip or knee into extreme positions if discomfort occurs. Our next technique is our activation technique, and this is going to re-educate and increase stimulation of a underactive muscle. The underactive muscle that we're going to focus on is your glute medius, and by using isolate stretching, this is going to enhance the motor unit activation as well as the synchronization of it and the firing rate of it. 3 to 5 times per week, 2 to 3 sets, 10 to 15 repetitions per side, making sure to have a 2-second end hold as well as a 4-second concentric going down. Contraindications is severe hip, knee, and lumbar spine pain. Precautions is avoid over-rotating the hips as well as no rolling backwards. So our last technique is our integration technique, and this is going to retrain basically all of our synergists and their functions. And so this is especially important when you need to go progressive. So you're going to have a 2-base support, so having 2 legs on the ground, do exercises. And then after that, you're going to do 1 leg support and maybe do some side lunges, going up in balance. And then after, you're going to want to do staying on only your sagittal plane, and then once you're comfortable, then you want to go into your frontal or transverse plane. And once you have good enough function of all those, you want to make sure you don't do overhead stuff, but then once you're comfortable, then you can start working on overhead. And so in the next video, we're just going to do one exercise that you can be doing, and so that's going to be a single leg balance test, and the next video will show you how to do it. So for this one, you're going to be doing 3 to 5 days per week, 1 to 3 sets, 10 to 15 repetitions, and making sure it's slow and controlled. So our contraindications is having acute injury, muscle strain or tear, as well as an injury to the joint involved during the movement. And our precautions are our special populations or neuromuscular disorders. So for the overactive muscle, which is our iliotibial band or your TFL, it's going to create so much tension on the lateral side of your leg or your femur that it's going to create a malalignment, and it's going to create this collapse of your knee. And so with your gluteus medius, for an underactive muscle, it's going to be way too lengthened, and it's not going to be able to stabilize the hip, and it's just going to create more, not the tension that it needs in order for the knee to stay straight and stabilized. So correcting these two would be vital for knee valgus. And not only is it those muscles, but it's so many other muscles because our body is a chain, and you need to make sure you get all your points. So, and another overactive muscle could be your lateral gastroc, and that could be way too activated, or another underactive could be your gluteus maximus. And so without those, it's going to contribute to your knee falling in. So we need to strengthen the muscles that need to be strengthened and loosen the muscles that need to be loosened.